Case Presentation by Quick Med Revision. For a quick and easy way of CVS case presentation, especially for MBBS student, I have jotted down the important points through which we can go. But this is not the main thing which you have to study. You have to study in detail, but this is for quick revision. To begin with, the history taking: name of the person, age in years, sex of the person, address, occupation. And next, chief complaints: so and so in so and so many days. That should be in chronological order. For example, if the patient gets breathlessness since 2 years and abnormal sensation of heartbeat since 2 months, the breathlessness since 2 year part comes first, then comes the abnormal sensation part. After this, uh, we have to take in detail about the presenting complaints via history of presenting illness. So, what and all the patient presents with when he has some cardiac manifestation. So, it includes dyspnea, chest pain, palpitation, syncope, pedal edema. The other symptoms include hemoptysis, cyanosis, decreased urine output, GIT symptoms, right hypochondrial pain, fatigability, and fever. So, to look in detail about each of these symptoms, that is, we have to ask in detail about dyspnea regarding duration, onset, grading, progression, aggravating factor, relieving factor, orthopnea, trepopnea, platypnea, paroxysmal nocturnal dyspnea, and any associated symptoms if present, such as wheeze and cough with expectoration. Similarly, we have to investigate each of the other symptoms: chest pain, duration, onset site, type of pain, radiation, diurnal variation, aggravating factor, relieving factor, any associated symptoms, any local tenderness. So, similarly, in palpitation, duration, onset, irregular, regular, precipitating factor. So, to continue with, we have syncope, pedal edema. We have to ask similar history in detail. The next is the past history, wherein we investigate about asthma, COPD, tuberculosis, diabetes, hypertension, ischemic heart disease, and seizure. And the next part, which is family history, plot down 3 generation pedigree. Then we have personal history, wherein we note down diet, appetite, sleep, bowel and bladder, if it's normal or if it's regular. Then habit, if he has any habit such as smoking, alcohol, tobacco, chewing, and if he has so, then smoking index and alcohol units to be calculated. Then we have drug history, wherein we have to see for drugs frequency and duration, and summarize. After you have taken a brief history, summarize what and all you have found. uh, Make sure you have mentioned majority of the positive findings. Then try to put differential diagnosis. To begin with, general physical examination, let's start like a 50-year-old male patient, moderately built, nourished, conscious, cooperative, well oriented to time place person. And make sure you begin with the vitals, wherein you mention in detail about pulse, for example, rate, rhythm, volume, character, wall thickening, any radio radial or radio femoral delay, or and make sure you have taken the pulse value. uh, then next we have arm, BP, which arm, which position. Then we have respiratory rate, irregular, regular, if it was abdominothoracic or thoracic abdomen. Then calculate JVP without fail when you have a CVS case. Then general physical examination: pallor, icterus cyanosis, clubbing, lymphadenopathy, and edema. Take weight, height, calculate mm, BMI. Next, the systemic examination. To begin with the inspection: chest shape, symmetry, any spine deformity, scars, precordial prominence. Serious pulsation, wherein you see for apical pulsation in aortic pulmonary area, sternoclavicular pulsation, left parasternal pulsation, epigastric pulsation, distended vein, and Palpation, there's main thing is you do for apex beat, apart from which you confirm shape symmetry. You palpate CVS pulsation, any thrills. Percussion is the only important examination which you do in CVS. Sorry, not percussion, auscultation. Percussion, it is not routinely done. Auscultation, the main thing which we do in CVS examination, wherein you look for heart rate, rhythm, and to summarize in simple diagram, in second intercostal space on the um, right upper sternal border, we see for aortic listening point, wherein you can hear murmur of aortic stenosis, and in the left upper sternum border, in the second intercostal space, you hear for pulmonic listening point, wherein you can hear PDA or pulmonic murmur. In third intercostal space, left upper sternal border, wherein I have mentioned here, you can listen aortic regurgitation, murmur, hypertrophic cardiomyopathy. And in fifth intercostal space, on the left sternal border, left lower sternal border, it's tricuspid listening point, wherein you listen for VHT tricuspid murmur, and mid clavicular line of left part, you hear for in the fifth intercostal space, that's mitral listening point, wherein you hear for mitral murmur, mitral stenosis, mitral regurgitation, mitral prolapse. So majority of mitral pathology can be heard in this fifth intercostal space. So when you auscultate in these areas, make sure you have auscultated all these areas. When you're mentioning in detail, mention about S1, S2, if any S3 is heard, if any opening snap or click heard. Then if you have a murmur case, you have to mention the timing of the murmur, grade, quality, pitch, configuration, best heard with bell or diaphragm, patient position, dynamic auscultation. And finally, auscultate the other areas such as axilla, epigastrium, clavicle, carotid, interscapular area. Once you have examined everything, uh, make sure you have mentioned the other systems, respiratory, non-vesicular breath sound heard or not, CNS, no focal neurological deficit, and per abdomen. Then finally summarize the only positive findings of your examination. Then you can give differential diagnosis, and this might look easy on a surface, but it isn't. Make sure you have repeatedly thoroughly prepared, and if you know this much basics, that could be enough for you to at least give some answers. Make sure you have gone through each and every pathology thoroughly, and your knowledge is up to the point. All the best.